puzzle come together. A key challenge, Subramaniam, and what concrete next steps do we need to take, and what factors should we consider so that in 2030, when the global community is, when we're looking back and evaluating the post-2015 development agenda, what will we review it as being successful as tackling NCDs? So when we look back, what will we consider our success?
I think in trying to answer that question, we have to recognize the problem is known to us, and the intended objective is also known. And adding further to what was said by the last speaker, although we might not have all the tools, but we have more tools than what we had before. And as the tools unravel themselves, is how we are going to utilize that to achieve the intended outcomes. So I think in that process is important implementation pathway with very well defined milestones and achievable key performance indicators for each one of those things which we want to achieve, and to follow that actually with great passion so that we can achieve it. So if you do that in that process, I think at 2030, when we look back, at least we will not be seen as having not attended to any things which we knew and which could have actually done and be able to achieve positive results.
Thank you, Dr. Any other panelists have any comment on that? So true.
I think on the question, sure, on the question of concrete next steps, in another place they were stated, I thought, very well, and I'll just repeat that because I think they're important, and that is we need to achieve universal health coverage and access. That is high quality health services and financial risk protection. We need to embrace the holistic approach. Too often I think we're still seeing NCDs as a health and a disease issue and not a development and a social justice issue. And so we also need, as has been stressed, to adopt the life course approach. And finally, I want to re-emphasize something that CARICOM countries have been making the case for, certainly the first I recall, and maybe it was even before this, was at the Commonwealth Health Ministers meeting in 2010. I want to continue to make the case of the call for the inclusion of the NCDs in the MDGs post-2015. I think if we can get those, then we would be going a long way to achieving what we're looking to achieve.
Thanks, Sir Trevor. Dr. Bitcher.
Just briefly, and the Honourable Minister of Health of Samoa had alluded to the recent Lancet article on the 25 by 25 targets, and the first really comprehensive modeling of the risk factors and how those play out in the achievement of the 25% reduction of premature mortality. A really important message there, and that links directly with political will, is there's no time to spare. I mean, if we're going to move to having a good chance in the world community in reaching those targets, the scale up has to start now. The multi-sectoral plans have to be prepared, and all countries need them to have them in place very soon. The voluntary global targets need to be translated, committed to, getting the tools in place, putting the action, having the monitoring and evaluation. The NCD Alliance countdown session on Monday night also emphasized the importance again, as we just emphasized. We need to measure. There needs to be feedback. There needs to be to accompany the roadmap. The DG has always said, "What gets measured gets done." So no time to spare, and that's backed up by the Lancet article.
Okay. Dr. Tuitama, do you have any comments?
Yes. Just a little to add. We're talking about tools one thing we should consider, and I feel is very important, is the diversity of cultures. The transformation of all these tools and the interpretation of tools to conform to cultural norms is the most important to me. Because what works for the North may not work for the South. What works for the East may not work for the West. Purely because of cultural restrictions and cultural norms of each country. And secondly, of course, we can't do away with funding. It's all right to have so many tools, but you need funds in order that the tools, it is the oil that lubricates the tool. So that is my decision.
Thank you, Minister. And Sir Peter also made the point of the context of different populations. It's clearly a really important one as we implement this globally, is to understand the context of different populations and how we adapt the tools for the different populations. So it's been thank the panel for helping us just to explore these. Firstly, before we conclude, just to thank the panelists. They brought a very enlightened perspective, and it's been, I think, an interesting discussion. Now it's over to you, Dr. Subramaniam, just to close. Thank you.
Thank you, Mr. Chairman. And first of all, I'd like to thank the panelists who participated in this function, co-organized by both the Government of New Zealand and Malaysia, to promote greater interest and focus on the issue which we still call as non-communicable diseases. And trying to summarize the views which were expressed today so that it could be used as a basis for our subsequent interventions in our respective countries. It is very clear from what all the speakers spoke that in our approach to the management of this group of this problem, there is an important need to emphasize on the need for primary prevention, which begins very early in life, and in fact it starts before birth. And in this leaflet here, there is a case study of a program which was done, a study which was done in Malaysia called Jom Mama, which was actually studying the issues related to intervention within young couples before marriage, in preparing them to be prepared to reduce the risk of NCDs, and what are the factors we have to take into control in trying to implement them. And of course, and the other programs which is already in way, that's the secondary prevention. So we all agree that the approach to this whole spectrum should be lifelong, that is before birth and continuing towards the entire phase of life. And it has been touched by all the speakers that the intervention should have very strong scientific evidence, and even particularly when resources are limited, and how to put the resources correctly into interventions which gives us the maximum result. And there are, of course, a lot of best buy interventions which are already there, in which results have been shown, like taxes on tobacco and alcohol, facilitating smoke-free workplaces, increasing health promotion campaigns, reducing the consumption of salt, sugar, and trans fat, encouraging physical activity, all interventions which have shown positive results as based by evidence. So there are a lot of interventions which could be used, which will actually give results, and the need for continuous work and closer collaboration between the scientific field and the public health field, so that the public health intervention will be based on scientific evidence was raised. I think that's very important for us to consider. And of course, it should be outcome-based and be measurable. And as what the minister from Samoa gave on the article from the Lancet, which actually stipulated specific outcome objectives in trying to reduce tobacco by 50%, alcohol by 10%, and salt intake by 30%. So if these are outcomes which you have to achieve by 2030, then of course there must be a roadmap which is going to measure the achievement of these outcomes and how we are going to do that. And in trying to achieve all this, I think all speakers have expressed the necessity for these programs to be driven by a multi-sectoral involvement, involving many of the agencies within the government and also outside the government. And in that line, in Malaysia, we have started a program of community empowerment, which basically means a healthy community leads to a blessed nation. And this program involves the training of grassroots leaders in being able to manage this group of disorders. In a village, the leaders in the village are actually trained, given the tools, and are given the tools not only to intervene, but actually enter the data and monitor the data. So our hope is over a period of time, it is at least my intended announced objective to reach out at least to 1.5 million Malaysians in the next 3 years, whose database which we actually will calculate and see how they are actually doing some 5 or 6 of the indices which have stipulated as to their progress. So likewise, I'm sure in each country there will be interventions of this sort, which involves a multi-sectoral approach. And there is a need, of course, of policies, both legislative policies and tax policies, which promotes this. And I was reading a statement which was given by our Director General, which says many of the risk factors of non-communicable diseases are amplified by the products and practices of large economically powerful forces, and market power translates into political power. So invariably, I think this is her words, and that is actually a correct statement. And in trying to handle this, it's very important that we have the correct policies and correct will to provide legislation which will support these policies. And another area which we have to be careful about is trade protocols which are done between countries. And 13 countries in the Pacific Rim are now in the midst of negotiating a trade protocol, Trans-Pacific Trade Protocol, in which Malaysia has outrightly said that tobacco should be carved out of the negotiations of this. But we are facing, of course, problems in trying to push the agenda. So these are issues which we face, and we have to be very clear-cut. That was actually a philosophical statement on Malaysia. Why should, in a liberalized trade liberalization protocol, tobacco be included as part of the liberalization processes? So, of course, the trade people have got a different view of this. So likewise, I think there is a need for us to be aware, and we have the power to ensure that correct policies and correct legislations are used to protect this. And Malaysia hosted the World Obesity Conference just a few months ago. And in that conference, there was an interesting debate on is obesity, is it the problem of the state or is it the problem of the individual? It's a very interesting debate which went to identify who has to actually try to manage this. I think rather than not going into who won and who lost the debate, but what is important is, I think while if you take the tobacco as an example, whatever said and done, despite all that we talked today, tobacco is a legal entity in most parts of the world. It's not illegal. So having allowed it to legally exist, we are asking our individuals to choose not to smoke. So this involves two things. Of course, the empowerment of the individual to make the correct choices in an environment in which alternate choices will always be there. So while the state's responsibility is to be able to provide the correct environment and correct infrastructure to lead a healthy life, at the same time the individual has to be empowered, given some knowledge and a commitment and a conviction to make the right choices so that they will be able to lead a correct and healthy life. And this is important. So I think the empowerment of the individual is an important part, and in that line, to support it is the political advocacy which was mooted by the Minister from Samoa and also by Sir Trevor, in which there is a need for a group, a very broad spectrum of group, which involves political leaders, NGOs, and other groups involved together in trying to be the advocates in the achievement of this message. And the last message which I would like to give is, while in government policies and government developmental agendas, many factors are given consideration, including environment, but the health impact assessment is not imperative on a lot of government policies and development agendas. So if there is a commitment that every development agenda, every policy agenda should have a health assessment to see whether it's health neutral, health positive, or health negative, then at least the minimum which a state can allow is health neutral policies and definitely not allow health negative policies, by promote more of health positive policies. I think this will be a good way to move forward, to have a health impact assessment as part and parcel of all the development and policy agendas which within a state, because as we all know, nothing can be more important to the people in a country than their own personal health. With that word, sir, thank you very much.